All right. Well, I suppose we could get started. So thanks everybody for joining for another round of WISM for this semester. Today we're pleased to have Mahmoud Elkasabi from RTI International presenting co-authored work with Hassan Khan about coverage in mobile phone surveys in low and middle income countries. So I'll let Mahmoud take over. You have the floor.
Thanks, Luke. And thank you for having me. Today I will be talking about the evaluation of mobile phones surveys in low and middle income countries, LMIC, and I will focus more on the coverage structure or the coverage bias. This work has been done with Azam Khan from ICF, and I was surprised this morning to see that the paper got published already a couple of days ago in the International Journal of Public Opinion Research. So the main motivation for this work is basically the fact that the field of survey research is evolving according to the settings and the challenges in the surrounding challenges and settings. And as survey researchers, we have a lot to learn from each other and from past experiences. And when you apply this on survey research across countries, we have a lot to learn from developed countries and applied on LMIC. So this idea is actually I have been thinking about for the past maybe 10 years or so, and only last year I got the data and the time to get it finished. So I will start my talk by a brief introduction or a brief history of the advancements of survey modes in developed and LMIC countries. And we'll talk about motivations and research questions and data methods results, and we'll end with a discussion. So when you look at the US and Europe, especially from the 70s, with the increase of landline telephones, the landline random digit dialing surveys started to rise, and many surveys moved from in-person or face-to-face interviews to telephone surveys. And this was the case between the 70s and the early 2000s. But this mode actually faced some challenges, especially with the decreased response rates and also the coverage issue. So perhaps in the 70s, the percentage of households with landline was very high, but this percentage started to decline. And what even made it worse in the 2000s, that basically the cell phones or mobile phones introduction. So we started to see many households moving from or giving up their landlines and only depend on their cell phones. And here we have a significant portion of the population who actually we call them cell phone only users or cell phone only households. So these households, they don't own landline, but they own at least one cell phone. It might be, and perhaps each individual has his own or her cell phone. And this actually this challenged survey methodologists, and then they basically started to use dual frame designs, where you have instead of just using the landline RDD, so you are supplementing this by the cell phone samples, and you are hoping actually to cover all individuals who either have cell phones or who live in households with landlines. So you only not covering people who don't have access to landline or cell phones, which is at that time was a very small percentage. However, the dual frame designs face the same challenges of the landline RDDs, which is again the declining response rates. And then luckily, like in the 2010, we started to see the address-based sampling frames, where actually you have a frame of almost all households, and you have their addresses, and you might have other information like perhaps their uh, phone numbers, or other demographic information about the residents of these households. And this opened the opportunity for a new designs like the mixed modes, where you can select a sample and you can administer different modes like phone, mail, or web. So on the other side, in most of the LMIC, uh, starting from the 80s, perhaps, we started to see uh, many national surveys conducted, and most of these are like conducted by government. And most of those actually they are face-to-face in-person surveys, and they are paper and pencil surveys. Until very recently, perhaps 7 or 8 years ago, I mean, this was the case. It's in-person, face-to-face. And here I'm talking about the surveys that's collected by the government. For example, the demographic and health surveys, the DHS, or the mix uh, surveys. And perhaps there are some exceptions where countries did telephone surveys, but it was only landline surveys, and they actually suffered from serious coverage issues, because the percentage of landline users in LMIC countries is very small. But then starting from the like 7 or 8 years ago, we started to see some countries started to do mobile phone RDDs, and this again came because of the increase or the rise of percentage of cell phone owners, and we started to see other forms of surveys where actually users can, or respondents can, use phones, but it's not necessarily their own phones. Like this example, that's the handset surveys, and these surveys were designed and collected by the World Bank, where actually, and especially for longitudinal surveys. So if you are selecting a sample of respondent and you would like to follow up with them perhaps each year or every 6 months, so you hand them a phone. So the first survey is actually in person, and then you hand him a phone set, and you basically in the second round, third round, and subsequent rounds, you actually collecting the interview over the phone. But this is not the form of phone surveys that we are interested in. We are interested in like the mobile phone surveys, where actually we are contacting persons on their devices. So the motivation for this study is actually that when the COVID hit, we started to see a lot of discussions actually about the feasibility of using mobile phones interviews to replace in-person or face-to-face surveys in LMIC. And we saw several reports and papers published about that. The second motivation for me was to examine the coverage structure. And I have seen in the past, in published work and in April, the conference, several talks about cell phones in LMIC's countries. And you would find during the discussions that actually they are using the penetration rate as the high penetration rate as their motivation or justification of why we can actually use mobile phone surveys in those countries. And this is something I am against, and I wanted to examine in this paper. So first I would define what is penetration rate as opposed to coverage rate. So the penetration rate is basically mobile phone subscriptions per 100 inhabitants. Whereas coverage rate is the percentage of individuals who own at least one mobile phone. So you can imagine that the penetration rate, it really depends on the number of subscriptions. So let's assume that here we are talking about the subscriptions, the residential subscriptions or the non-business one. But from my experience in many countries, actually, you will find that the one person might have 2 or 3 or even 4 subscriptions lines from different providers, because each provider would give you different benefits. And this is the case in many countries in Africa and in Asia. So using the penetration rate actually as a justification of or as a proxy for coverage rate now is not very accurate, or it's not good. It's not a good practice. At the same time, in many of the talks, there is a shortage of proper assessment for coverage bias, and this is something I wanted to fill in this talk. The third motivation is actually using reliable data on coverage rates, and actually reliable data on coverage rates is available actually. So instead of using the penetration rate, we have actually reliable surveys like the DHS or the MIX, that actually these surveys, they collect data about the phone ownership, either landline phone ownership among households, or even on the individual level, whether the person have a cell phone or personal cell phone or not. So the research questions I wanted to examine actually is, are mobile phone penetration rates accurate proxies for coverage rates or not? And how does the mobile phone coverage structure vary across LMICs? And here I'm not talking about all LMICs. We have a sample of 36 countries, and these are the countries I was able to have data for. And what are the correlates of mobile phones ownership and coverage across different countries, and how different are proxy covered adults in comparison to directly covered and not covered adults? And later I would define what I mean by proxy covered adults. So regarding the data, we used data from 36 countries, mainly from the 2 surveys, the DHS and the MIX. And DHS is a survey that's collected, and both of them, they are collected in most of the Africa, Asia, and South America countries. The DHS is sponsored by the USAID, and the MIX is sponsored by the UNICEF. And in these surveys, there is household questionnaires that actually collect information about all individuals of the households, and at the same time collect some information about the house itself, like the materials that is used for the floor, the wall, and the whole house in general, and the assets as well. What is the assets that the household own, like the phones, TVs, and cars? A very long list of assets is collected. At the same time, in these surveys, there are questionnaires for women, all women from 15 to 49, and for men in reproductive age. And in these surveys, is very long questionnaires that ask about different topics, mainly health topics, and questions about their kids as well. So in the list we actually used data only from the past like 6 or 5 years, starting from the 2016, between 2016 and 21. And most of the countries were in Africa and then Asia, and we had also a few countries from South America, Europe, and Oceania. So before proceeding with the data and methods, I would like actually to comment about the sharing culture, because this concept is actually very important for the recommendation or the discussion in our paper. So the sharing culture is actually very common in LMIC countries, especially in rural communities. We have found several published papers about the sharing culture in general, and actually sharing assets within the household or even within the village. Uh, and this this concept is actually related to a term that we coined in our paper, and we tried to actually explore and to see how common it is, which is the proxy covered population or the proxy coverage. And by proxy coverage, we're actually referring to population who is actually not directly accessible. And here, if we are talking about the cell phones, so this is a population that actually they don't own cell phone personal devices, but actually they are accessible through, they might be accessible through devices that owned by other family members within the household. And assuming that the sharing culture is common in these communities, so potentially these individuals can be covered or we can have access to. So from our data and given the amount of, or the questions that's asked in the household questionnaire and the individual questionnaires, we were able to, for each country, we were able to actually define 3 domains or 3 subpopulations, and we will use these 3 subpopulations in our analysis. The first subpopulation is the directly covered individuals, and those are individuals or persons who actually own a personal device, personal mobile phone. And the third one is the not covered individuals. And these individuals, they live in households without any cell phone. So themselves, they don't own a cell phone or mobile phone, and none of their family members own as well. But there is the third category, or the one in the middle, which is the proxy covered individuals. And those individuals actually they don't own a personal mobile phone, but there are other members in the household or in the family, they own phones. So the household have at least one mobile phone, but the person himself or herself, they don't. So looking at the bias structure here, so we have the 3 domains. Let me try to use the laser. Okay. We have the 3 domains here. We have the D, P, and O. The D are basically the owners of personal cell phones. The P are the proxy covered, and the O are the non-owner. So when you look at the non-coverage bias equation, it has 2 components. The first component is for the non-coverage rate, and the U here is basically the population that's not covered. And in traditional surveys or in all cell phone surveys now, this U represents the P and O. So those are the persons, number of persons who don't own personal devices. And the N is the overall population. And then the difference between the covered and the not covered. So this is the difference between the Y based on the covered population, which is the owner, and the non-covered population. So what we are hoping is actually to explore this subpopulation in the middle, which is the proxy covered population. And if we can actually prove that it's somehow similar to the non-owners, and at the same time, if we are able to have access to this population, we will be able to decrease the non-coverage error or the non-coverage bias. So by accessing or having or interviewing this population, the non-coverage bias would reduce to the following. The non-coverage rate would be just the percentage of non-owner by all, and the difference between the covered, including both owners and proxy, and the non-covered, which is only the non-owners now. So for the methods, first we examine the coverage structure. So we try to profile different countries according to a mobile phone coverage structure. And we compare between the coverage rates and penetration rates in each country. And the second one is relating to the differential coverage. And here we studied the association between mobile phone ownership and coverage and demographic characteristics. And we did this analysis according to the profile that we created in the first stage. So in countries with low and moderate mobile phone coverage, we use logistic regression to model whether the individuals has a personal mobile phone or not, with socio-demographic characteristics as independent variables. And in countries with low mobile phone coverage, we actually use the multinomial logistic regression to model whether the individual is directly proxy or not covered, and with socio-demographic characteristics as independent variables. Then we examine the differences in outcome variables. So as I mentioned, the DHSMX, they provide a lot of variables, study variables, and the good thing about both of them that actually both of them collect a lot of common questions. The same question is asked in the two surveys, so it was easy for us actually to compile a list of indicators or study variables and be able to study these indicators across different countries, regardless whether this is a DHS or a mix. So in countries with low or moderate mobile phone coverage, we used logistic regression, but this time we modeled the study variable itself. And as independent variables, we used the mobile phone ownership, and we controlled the model with using background characteristics as other independent variables. And in countries with low mobile phone coverage, we actually explored the odds ratio of being directly covered versus not being covered, and the odds ratio of being covered versus not being covered. So here, this is the difference between the penetration rate and the coverage rate. The penetration rate is in the red bars, and the coverage rate is the green bars. So as you see, almost in all countries, the penetration rate overestimates the coverage rate. And in some countries, in 1/3 of the countries, actually, it shows that it has 100% penetration rate. So if you are using the penetration rate as a proxy for coverage, you might think that you have 100% coverage. But actually, if you are using the actual coverage rates, no, actually, it's sometimes it's even less than 90% of coverage. So the first lesson here, that actually penetration rates are not that is not accurate measure for coverage. When it comes the three domains, the directly and the proxy and the not covered population, we can, or we actually divided the countries into three domains. The first one is the high coverage countries, and these countries have more than 85% of direct coverage. And the second group is actually the moderate coverage countries, and in these countries, the percentage of directly covered population between 60 and 80%. And then you have a sizable proportion of the proxy covered population. So you have between like 20 to 25 or more percentage of population who are proxy. And then you have a very small, most of them small portion of individuals who don't have coverage at all. The third group of countries, actually, you have less than 55% of direct coverage, and you have a high percentage of proxy covered and high percentage of not covered at all as well. So when it comes to the second objective is actually to explore the correlates of the coverage. So we found that the mobile phone owners less likely to be women, more likely to live in rural areas, more likely to be educated, or older, more likely to be educated, and more likely to be married, and more likely to be in higher income groups as opposed to the non-owners. Now, when we look at the odds ratios considering the proxy covered population, we found that the proxy covered population is more likely to be women. It's more likely to live in rural areas, and it's more likely to be younger age group, and more likely to be illiterate or literate, and more likely to be unmarried, and to be in lower income groups. What we noticed here that sometimes actually this population of proxy covered individuals have common characteristics with the non-owners, and sometimes it have common characteristics with the owners. So from these data, I can tell that this proxy population is actually usually like a young women who live in rural areas, and perhaps in middle with middle income, low to middle income. So in my mind, this can be like a daughter or in a family, and who doesn't necessarily have a phone, but other family member they have, and this makes sense actually. When it comes to the outcome variables, so here I'm just presenting some of the outcomes, but there are more in the paper. And here we are looking at the odds ratio of the survey outcome according to the mobile phone ownership. And mobile phone owners are more likely to live in a household with where one of the members have a bank account, more likely to live in households with improved toilet facility, clean fuel for cooking, and or have access to improved water, more likely to be a person who heard about HIV or AIDS before, more likely to they watch TV, listen to the radio, and read newspaper. And these results are very consistent actually with results that we have seen in the literature before. But what's more different here is actually when you look at the proxy covered population. So you'll find here the comparison between the non-personal cell, which is basically the proxy covered, and the personal. This is the directly covered. So here the comparison is between actually the non-covered or the person who is not directly or proxy covered at all with the other groups. So you'll find that it seems like proxy covered are somehow similar to the directly covered, that they heard it might be a person who heard about HIV before, and they watch TV, they read newspapers, they listen to the radio, but to the extent that's less than the directly covered population. So they come in between the directly covered population and the not covered population, which for me is actually mean that if you are able to cover this population, you will be able to cover a population that have a unique characteristics, and this might contribute to the reduction of your non-coverage bias. So the discussion or the lessons that we can learn from this research, that penetration rate as proxy for coverage is not reliable, and this is we have seen from the results for most of almost all countries. There was an overestimation of the coverage if you are using penetration rates. The second lesson is actually there are reliable data that we can use to study the coverage rates. They just need more, like you need to have access to it. I mean, all these data sets, they are available to any user who can just create a account and get the data downloaded and use it. None of these data is restricted, so they are there. The variables is there. It just needs some data analysis. Try to find the most up-to-date data set to use. The third lesson, and I believe this is the highlight of this research, is the proxy covered population. Because the proxy covered population, we have never seen actually any research talking about this population and how the potential of using this population or approaching this population to decrease the non-coverage bias. The proxy covered population is sizable in some countries. It might be a big population, and from the analysis we have done, they have a unique characteristics. And given the fact in these settings or in some countries, the fact that there is a sharing culture, I believe it's a good opportunity for practitioners, survey researchers who are collecting data in these settings, actually to try to approach this population and try to put the protocols that would allow them to approach this population and examine the impact on the non-coverage error. And I believe this is my last slide, and I would be happy to answer any questions if you have.
Okay, great. Thank you for sharing that research with us. We can open it up to Q&A, so you can raise your hand on Zoom and ask your question live or put it in the chat. Yeah, this is really interesting. It's something we thought about a lot as we were doing surveys and during COVID over the phone. I was just wondering, like, so how, maybe this is explained in the paper, but how do you handle these two groups in practice? Like, would it be treated as two separate populations? Are you just, if you're doing RDD, do you just call and then, not make a distinction between the owners and the proxies? Or are you looking for owners and then, as a separate matter, looking for the proxy group?
Yeah, that's a great question. I mean, in my mind, it would be something like, and this is not necessarily should be the case, but these are just some ideas I have. I mean, that the general idea is actually to access this population. One option might be is actually you are calling the cell phone and asking about the eligible person, the other eligible persons within the household. So instead of just doing the interview with the person who answered the phone, which might necessarily be actually the owner of the phone as well. So you always, when you collect these surveys, you need to ask whether the person is the owner or not. But perhaps methodologists can think more about, okay, why we don't actually ask about the household. Because, for example, if you are, and this happens because when you do a dual frame, for example, landline and cell phone, you have to ask about the household. You have to ask whether the household have a landline or not to be able to adjust for the multiplicity. So I don't see this as impossible. You can ask about other eligible persons and whether the person can actually, you can finish the interview and whether the person can actually hand the device to the other person or not. So far, these just ideas that need to be piloted or experimented and see whether it can be done or not. I don't see it as hard to implement in LMIC countries, especially in rural areas, because it is common actually, and it's something that is not that it can be done. Perhaps in here, in other countries, in developed countries, you can think about the mobile phone as very personal device or something personal, but in other settings, it's not the case. Yeah, but I believe this is area actually for future research that can be, it needs a research that be done on the ground.
Yeah, for sure. Stacy Frank, do you want to ask your question?
Sure. This is Stacy Frank from the International Republican Institute. My team was actually recently discussing whether and how to use mixed data for weighting of national population surveys, since it does incorporate the household survey and it has these other surveys for different age groups for men and women. So in that vein, I was wondering if you could talk about any adjustments you made to the data that you were using so that it would be reflective of the national population, or if there are limitations to it because of the data source you were using.
Yeah, thank you for your question. I mean, one strength of this of the analysis, and actually this is one of the conclusions that we have, that reliable data is there. So actually, no, we didn't need to do any adjustment for the data, because the DHS mixes in these countries, this one of the most reliable data that is used for producing different variables or indicators about health. And especially on the national and regional level. So we actually used this point to justify why there is data, reliable data, that you can use to study the coverage. So we haven't done actually any adjustment. We didn't need to. As a matter of fact, the DHS mix can give you the same analysis can be done even on the regional level or even on the sub-regional level. it depends on the countries. So some countries you can even go down to the province or state level. So yeah, we didn't need to do any adjustments.
Thank you.
Sure.
I don't know if this probably isn't something you can answer, but I'm just wondering about what the the distinction between ownership and like proxy coverage. So if you think about a landline in a house, like the all the people in the house might say they own it to some extent, or it's their phone number. Especially like if it's a husband and wife. If you have one cell phone for the family, like you could consider that multiple people might say they own that phone versus one person owning it and others.
Yeah, I mean, thank you actually for reminding me of that, because yeah, that's interesting point. And I have been using this actually point to justify why actually sharing cell phone is something, it is not impossible, because actually if you think about the landline as well, it is actually owned by the household and it has been always used. You pass it to the eligible person or to other persons. You can think about the cell phones in the same way as well. The challenge with the cell phone that you define it as a personal device. But yeah, I mean, my argument, although it's a personal device, it can be passed also to other family members, especially if you're just doing an interview. So yeah, I mean, going back to your question, like in my definition, I define the directly covered by the person who own the device, and the proxy is actually a person who live with that person within the household, but they don't own a personal device, but we can access this person through the other device, and this is why I called it proxy.
Yeah, I guess I'm wondering more about, like, let's say a husband and wife have shared finances and they like buy a cell phone for their family. Maybe this is like a very specific scenario, but like they might both say they own it.
Yeah, I mean, yeah, no, oh, okay, I see. But for me, for the data collection, you don't actually care much about who owned the phone, even because at the end you would like to actually cover whoever at the household who are eligible. So although it would be nice to define these domains during the interview, but I mean, at the end, actually, you can think about it actually as the person who answered the phone, as opposed to other eligible persons within the households, because actually the phone might be actually the phone might be for with a young man or a young woman, but not I mean, the owner of the phone, it might be the one of the parents. So it really depends on how you ask about who is the owner, or maybe you can ask about the main user. But do you really need this? No, I mean, in my mind, no. I mean, because you are not using this for any adjustment. The idea is actually try to not just collect the interview from the person who answered the phone, collect it from other persons who don't actually have phones. And you can also think about other designs where you ask about persons who don't have phone, and you select one at random, or select a sample at random. So you will sample have a variety of respondents who actually answer the phone from the first time, or owners, and other persons who actually didn't answer and they don't have a phone. And the only way for you to get access to those non-owners is by asking the person who answered, can you pass the phone to someone? Is there anyone who doesn't own a personal device, and can you pass the phone to them? So this is the key change I'm thinking about.
Got it. Okay, do we have other questions or comments? Well, I'm excited to read the paper and the final version. I think this is really useful for, us who do phone surveys. Very important to think about these different populations. Yeah.
Mhm.
Okay, well, I think we can wrap up there then, seeing no other questions. So please join me in thanking Dr. Elkasabi for your wonderful presentation and sharing this research with us. Congratulations on the publication, and hope everybody can join for our last talk next month with some folks from University of Chicago and 26 Technologies. So thanks again, Mahmoud.
Thank you so much, Luke. Thank you, everyone.
Yeah. Bye-bye.